Hi, this is Angela with Angela's Nurse Toolbox. Let's talk about the difference between blood glucose levels and hemoglobin A1c. Your blood glucose can be obtained through a capillary blood glucose glucometer that we are checking it through a finger stick. It can also be obtained with your annual lab work. That tells us your specific glucose level at that time. It doesn't tell us how well you've been controlling it over the past few months. It's just telling us what it is right now at this time. With your hemoglobin A1c, this is your average of your blood glucose levels over the past 3 months. So this number is super important, especially when we're trying to diagnose diabetes. We want to know how well controlled your sugars have been. So if you are below 5.7, that is normal. If you're between 5.7 and 6.5, this is now screened as prediabetes. Numbers greater than 6.5 can help diagnose if you have diabetes. So this is a very important number that we're seeing a lot more labs ordered for a hemoglobin A1c. We really want to pay attention to this, especially if we have a diabetic patient, because their goal is to be less than 7%. That means that their sugars are very well controlled. So if you have a patient that is diabetic, you want to look at their hemoglobin A1c to see how well their sugars are controlled. They might tell you, oh, I checked my sugars, they've been fine. But in reality, they could be as high as 14%. And we really need to fix that. Because we know if those levels are higher than 7%, diabetic patients can have a lot more complications occur with their diabetes. They have decreased wound healing. They can have problems with vision, foot care, infections. So we really want to know what your number is. So that's a very important number with your hemoglobin A1c. So I hope you know your numbers. If you like, subscribe to my videos. This is Angela's Nurse Toolbox.